Hello friends, welcome to our YouTube channel Medification. So today in this video we will study on the topic of rape under the subject of forensic medicine. So how can we define a rape? In simple terms, the penetration, no matter how slight, of the vagina or anus with any body part or object. Oral penetration by the sex organ of another person without the consent of the victim can be classified as a rape. The complete act of intercourse is not necessary for the consideration of the rape. Even the slightest penetration of the penis within the vulva, such as a minimal passage of glans tip between the labia with or without the emission of semen or rupture of hymen, can be considered as a case of a rape. Rape can be committed even when there is inability to produce a penile erection. Corroboration by eyewitness or circumstantial evidences are very necessary in such cases. Now, examination of victim and the collection evidence. In the proper medical examination of a victim, all physical signs such as injuries should be corroborated with the history given by the patient. There should be collection and preservation of all physical evidence for laboratory examinations. There should be some questions which should be answered from the examination of the victim, such as whether there is evidence of recent sexual intercourse, whether there is evidence of previous sexual intercourse, whether the physical signs present confirm the use of force or any type of drugs, whether the physical findings are consistent with the history given by the patient or the victim, and the most important is whether the medical evidence confirms the allegation of the rape. Now, in evidence collection, our first topic will be about clothes. Clothes are very important because they are site of many DNA and physical evidences such as blood or seminal stains, hairs, fibers, fingerprints, etc. Ideally, each item of clothing should be removed by the patient in the presence of a doctor. The patient should be standing on a clean sheet of paper, and anything that falls should be preserved for the chemical and laboratory analysis. Each item of the clothing should be examined for the various stains such as blood, semen, etc. If the offense has been committed in an open place, corroboration can be sometimes be obtained by finding the grass, leaves, mud, etc. on the buttock or on the back. The clothes be dried, stored in a clean paper bag, sent to the laboratory. Foreign hair fibers found on the clothes or on the skin surface must be preserved and compared with those found on the accused. Now, general examinations. A victim should be examined for the marks of violence such as scratches, bruises, lacerations, and the area of tenderness resulting from the struggle as regard their appearance, extent, situation, and probable age. The extent and nature of general injuries should correspond to the victim's description of the assault. If the throat had been gripped or if a severe blow is struck on the head, the victim's capacity for resistance becomes greatly reduced. The age of injury should be noted. Fingernail clippings or scrapings from the beneath the fingernails should be placed in envelopes marked right and left, labeled and sent to the laboratory. Marks of violence, especially bruises and scratches, may be found like on the mouth and throat, produced while preventing her from calling for help. Bruising of the lips and even tearing of the inner aspect may be found due to blows or rough handling. The marks can be also found on the wrist and arms where the accused man seized her forcefully. On the back of the victim, especially shoulders and buttocks, from the pressure due on the gravel or hard ground. On the thighs and buttocks from the struggle to achieve intercourse. In some victims, true bite marks and love bites may be usually found on the breasts, which are often manually squeezed or manipulated. Now, hairs. Hair samples should be from the head should be taken from the front, top, back, left and right side. In a pubic region, the hairs on the pubic bone can differ from the hairs in the vagina or scrotum. Therefore, both these areas are sampled as comparative standards. In a case of decreased victim, the 15 to 20 pubic hairs are pulled with the forceps and placed in a separate envelope, so the root characteristics are available for the comparison in the future. In the living victim, the 15 to 20 hairs are cut, not pulled from the victims. Foreign hair and other foreign substance, if found, should be placed in a clean envelope, sealed and labeled. If the hair is intact, the tandem repeat analysis on the root can be performed. If no root is present, mitochondrial DNA typing can be done on the shafts. Now, seminal stains and blood stains. The pooling of seminal fluid in the vagina is a sign of recent sexual intercourse, but this pooling rapidly disappears. The areas of seminal swelling or pooling will show fluorescence by the use of ultraviolet lamp. Any soiled area, especially on external genitals, tops of thighs, buttocks, abdomen and hands, should be swabbed with a cotton swab, moistened with saline, air dried and placed in a sterile container. Dried seminal stains found on external genitals and thighs should be scraped with a blunt knife and sealed in a packet and sent to the chemical examiner. The presence of spermatozoa in vagina, secretion of children and grown-up virgins is a positive sign of sexual intercourse. Swabs must be taken from the area of introitus and the perineum, as the seminal fluid may leak out of the vagina before the hymen is examined. A swab of cervical mucus can be taken if the offense was committed more than 48 hours back. The presence and absence of blood stains about vagina and leg should be noted. Determination whether the stains could be due to menstruation, injury, or whether the blood can be of accused also. Profuse bleeding from the vagina will wash out all the seminal content and spermatozoa are not found. Now, when real diseases, the presence of any discharge due to gonorrhea or inflammation of parts or signs of syphilis should be noted. The degree of normal cleanness of the woman should be pointed out. Redness from the chronic inflammation or due to irritation by a chronic discharge must be differentiated from the effect of recent injury. Other STDs such as herpes simplex, HIV, human papillomavirus should be noted down.